This podcast is for educational purposes only and is intended for medical professionals. It does not provide medical advice or establish a provider-patient relationship. Always consult a qualified healthcare provider for medical concerns. While we strive for accuracy, medicine evolves, and listeners should verify information with trusted sources. Views expressed are personal opinions and do not reflect any organization's policies. Listener discretion is advised, and we assume no liability for reliance on this content. All rights reserved. Unauthorized use is prohibited. Welcome to Pathora, Medicine in 5 Minutes, where we simplify complex medical topics quickly, clearly, and maybe even a little fun. Today we're exploring Post ICU Syndrome, PICS, a collection of physical, cognitive, and mental health impairments that affect patients after a stay in the intensive care unit, ICU. Whether you're a medical professional, a resident, or just medically curious, stick around as we break down what it is, how it presents, and how to manage it, all in under 6 minutes. What is Post ICU Syndrome, PICS? PICS refers to new or worsening impairments in physical health, cognitive function, or mental health that develop after an ICU stay. It can affect patients as well as families and caregivers, leading to emotional stress and caregiver burden. Why does it happen? ICU stays are often marked by severe illness or injury, prolonged mechanical ventilation, sedation and immobilization, delirium or prolonged confusion, sepsis, multi-organ failure, or hypoxia. All these factors contribute to physical deconditioning, neurocognitive dysfunction, and psychological distress. How common is it? 30 to 50% of ICU survivors develop PICS, more likely in patients with prolonged ICU stays, mechanical ventilation, or sepsis. Family members may also experience stress-related disorders called PICS. Symptoms. What does PICS look like? 1. Physical impairments. ICU-acquired weakness, muscle wasting and loss of strength, persistent fatigue and reduced mobility, shortness of breath due to lung injury or weakened respiratory muscles, chronic pain, often from immobility, inflammation, or procedures, cognitive impairments, memory loss, and difficulty concentrating, similar to mild dementia, executive dysfunction, trouble with planning, decision-making, or multitasking, brain fog, persistent feelings of confusion or slowness. 3. Mental health impairments, depression, up to 30% of ICU survivors, anxiety related to fear of relapse or financial stress, post-traumatic stress disorder, PTSD, flashbacks, nightmares, and hypervigilance due to ICU trauma. Diagnosis: identifying screening tools, physical function tests like grip strength and timed walking tests, cognitive assessments such as the Mini Mental State Examination, MMSE, mental health surveys including the PHQ-9 for depression and GAD-7 for anxiety. 2. Imaging and labs, rarely needed unless ruling out brain injury, hypoxia, or stroke. Management: how do we treat it? 1. Physical rehabilitation. Early mobilization in the ICU reduces muscle loss and improves recovery. Physical therapy and occupational therapy to rebuild strength and coordination. Respiratory therapy for lung rehabilitation, especially after ventilation. 2. Cognitive rehabilitation. Cognitive therapy, memory exercises and brain training programs. Speech therapy for language impairments. 3. Mental health support. Cognitive behavioral therapy, CBT, treats anxiety, depression, and PTSD. Medication management, antidepressants and anxiolytics as needed. Peer support groups help patients and families share experiences and reduce isolation. 4. Multidisciplinary post-ICU clinics. Teams include pulmonologists, rehabilitation specialists, and mental health providers. Focus on comprehensive care and long-term follow-up. Preventing PICS. Can we lower the risk? 1. Minimize sedation. Use lighter sedation protocols and perform daily wake-ups in ventilated patients. 2. Early mobilization. Start physical therapy even while patients are still in the ICU. 3. Delirium prevention and treatment. Use orientation tools, natural light, and sleep promotion to reduce confusion. 4. Family engagement. Educate families to support recovery and provide emotional stability. Key takeaways. Post ICU syndrome, PICS, is common in ICU survivors and involves physical weakness, cognitive dysfunction, and mental health challenges. Diagnosis requires screening tools for muscle strength, memory, and mood disorders. Treatment focuses on rehabilitation, counseling, and multidisciplinary care to restore function and quality of life. Prevention during ICU care, like early mobilization and minimizing sedation, reduces the risk. That's it for today's episode of Pathora, Medicine in 5 Minutes. Don't forget to subscribe, share, and leave us a review. Thanks for tuning in, and as always, stay curious and keep learning.